Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Color of the urine in some important diseases. So first we need to know what is the normal color of urine. So the normal color of urine is a pale straw. So the normal color is nothing but the pale straw is the normal color of the urine, and it is due to the presence of the urochrome. So it contains the presence of the urochrome. Next is what is the abnormality of this. So the very first abnormality is going to be in terms of smoky. So in terms of smoky, or you can call it the cloudy. So in terms of smoky or the cloudy, what is the cause? So it is smoky or cloudy in terms of the AGN as well as the nephrotic syndrome. So in terms of nephrotic syndrome or the AGN, it is smoky. Next is gross blood. Gross blood, it includes the urological causes. So gross blood, it includes the urological causes, there is presence of the nephrological causes as well as the hematological causes. So there is hematological causes. It includes the PNH. Next is we look at the red color. So there is red without blood. So there is red without blood. So red without blood includes, it means that there is a brownish tinge which is given to the urine. So there is presence of the brownish tinge. And this is caused, where is it present? So this is present in the rhabdomyolysis. So it is present in the rhabdomyolysis as well as present in the beetroot ingestion. So it is also present in the beetroot. So beetroot ingestion. Next is we look at the tea or the cola colored urine. So there is a tea or the cola color of the urine. So tea and cola color of the urine is from the hemoglobinuria. So it is the hemoglobinuria. So tea or the cola colored urine is present in the hemoglobinuria. Then we move on to the high color of the urine. So where is high color? High color of the urine present. The high color of the urine is present in terms of the bilirubinuria. So bilirubinuria. Next is what darkens on standing. So in terms of what darkens on the standing. So darkens on the standing will be the alkaptonuria. So it is alkaptonuria. Now is a very important segment where we will be looking at what are the drugs which causes the color change in urine. So in terms of drugs. So where is orange seen? Orange, the color, it is given by the rifamycins. So it is the rifamycins which impart the orange color. So rifamycin, it can include the rifampicin. So rifamycin, it includes the rifampicin. Next is the rifabutin. So it also includes the rifabutin. Then comes the rifapentin. So rifapentin. So all these are present in the rifamycins. Next, what is included? There is also the B complex which is included. So B complex also, it imparts the orange color. Now let's look at the blue color. So when you look at the urine, if it is blue, it can indicate the ingestion of the amitriptylines. So it includes amitriptyline, it includes the methylene blue also. Methylene blue. And lastly, it can include the copper poisoning. The copper poisoning also, it presents with the blue color. Now let's look at what about the brown color. So in terms of brown color, what is it? So in terms of brown color, it can be due to the chloroquine. So it is a chloroquine can be the reason for the brown color, or it can be the quinine. So chloroquine, quinine. Then comes the primaquine. Primaquine as well as the nitrofurantoin. So primaquine and the nitrofurantoin, then the chloroquine as well as the quinine. Now let's look at yellow. So when you look at yellow, it includes a tetracycline. So yellow includes tetracycline. Then comes the pinkish. The pinkish includes a deferoxamine. So it includes a deferoxamine. Then we look at green. So what does the green include? So green includes a triamterene. So yellow is tetracycline, the pink is for deferoxamine, and green is urine is seen in terms of the triamterene. Next we look at what darkens on standing. So what darkens on standing? It will be the metronidazole methyl dopa. So it will include the metronidazole as well as the methyl dopa and the imipenem silastine. So imipenem silastine. So this will cause which is darkens on the standing. To learn and grow daily like this, please do subscribe.